and welcome to the CDO Magazine interview series. I am Della Shea, and I am the Chief Privacy and Data Governance Officer at Symcor. And we are partnering with the CDO Magazine, MIT CDO IQ, and the International Society of Chief Data Officers in a series of interviews. Today, I have the pleasure of talking with Dan Sanders, who is the Senior Vice President of Technology, Operations, Security, and Service Delivery at Avaneer Health. Welcome, Dan.
Thank you. Great to be here.
So before this interview, we had an opportunity to talk about a lot of the interesting things that Dan is working on. You're going to hear a little bit about his interest in blockchain in particular and how that's being leveraged within the healthcare sector. But before we get started, Dan, I'm hoping that you can tell us a little bit about your journey on your background, particularly from that IT and IT service delivery perspective, and how you're seeing that being an important perspective on how we can truly leverage the value of data.
Absolutely. So I've been in IT now for 26 years, in about 15 of those in direct or indirect healthcare IT. And I've helped bring solutions to market from McKesson, Anthem, as well as build some successful IT startups. And while that's been very gratifying to see the impact that my career has had, it really brought to bear the issue of how disconnected our healthcare ecosystem is, and it has to be addressed. It's pressing. It impacts all of us, our loved ones, our children, our parents, our friends. And that's why I'm so excited about building a healthcare network that is enabled by blockchain and will serve as the backbone and infrastructure with the utilities necessary to accelerate all of healthcare in connecting how we work together.
Well, it's really interesting because healthcare is one of those industries that, it's really there for the good of all of society and mankind. But in order to be able to deliver that effectively, cost efficiently, et cetera, there's a lot of challenges, particularly when it comes to technology and the ability to be able to share data among various stakeholders, such as the healthcare providers and patients and whatnot. So technology is a really important foundational aspect of being able to drive value and to drive that better healthcare outcomes now and also into the future. So what do you see as being some of the key challenges, and where do you see technologies like blockchain being able to facilitate the improvement of those outcomes?
Absolutely. Yeah, this really drives to the heart of the matter, because blockchain in and of itself, its foundation is an immutable agreement system that solves for a lot of the problems in entities' inability to work together efficiently and effectively. Everybody has experienced the siloed nature that healthcare can introduce, and a lot of the repetitive, redundant tasks that have to be carried out. But blockchain offers up this opportunity to jointly operate without these traditional fears and risks of opening yourself up to another entity's process and requirements, and allows data to be decentralized, yet fully transparent where necessary and appropriate, and highly secured. So it's ultimately going to allow us to take on these old problems that were almost considered unsolvable and have existed for decades, and then open them up to brand new ways of solving for them, and honestly, new ways of us working together. We've seen this transformation a lot in technology industries. It's happened in the financial institution in the 80s and 90s. And now we're seeing this healthcare inflection point, and blockchain is going to be at the center of it.
Interesting. So Dan, blockchain is one of those technologies that are somewhat misunderstood at times. Is there a simple explanation that you could provide to the viewers of this interview, just a high-level description of what blockchain is and how it applies within the healthcare sector?
Absolutely. So blockchain, what it does is it allows two parties on both sides of a transaction to have an automated agreement to say, these are my requirements, you must meet them. Yes, I understand those requirements, and I absolutely will supply to them, and help reduce the human interface burden that's so prevalent in healthcare. And there's never been a better technology or really efficient, good way of solving for those problems until technologies like blockchain came along. And so when you can do automated agreement against necessity on both sides, streamlines the entire process. It will make everybody's life easier to address those needs and focus on the areas that aren't minutia, but really impactful.
So would it have the ability to connect essentially multiple stakeholders within that healthcare ecosystem, such as, the healthcare
Absolutely.
providers and the patients, and also down through the supply chain?
Yes, absolutely. And that's one of the greatest benefits of it is it can bring these multiple parties together as part of a transaction set instead of it being so siloed as we find it today. And it's not that the siloing is bad, but it was a necessity because we didn't have the types of forward thinking and technologies like blockchain.
But I think that's really the story of technology is it's constantly evolving. As things evolve and new problems, that's where technology often comes in to help play that critical role in terms of transforming the way we do things. So from a healthcare perspective, you're certainly on board and you're excited about blockchain. Do you think that's a representation of the healthcare sector generally, or do you think the healthcare is just really starting to catch on to this?
Well, the healthcare sector as a whole is now in a better position to widely adopt blockchain than ever before. We've seen this swell of a movement, basically identifying the need to protect individual data and allow it to be more secure, but actually have a verification mechanism that's traceable back to the person. So it's the inclusion, like we were talking about, it's the inclusion of all into the transaction set. And blockchain does this. And interestingly enough, coming out of the pandemic, it has actually enforced and emphasized the need for blockchain and other technologies, and that our traditional inefficiencies are completely unacceptable. If we don't have a way of interoperating better, more efficiently, we put everyone at risk.
And I couldn't agree more. I'm sure that in a lot of parts, not just within healthcare, but other industries, are still using old technologies like faxing information back and forth. So it's really exciting to see how technologies can help build that greater connectiveness around stakeholders.
Absolutely.
So from a network infrastructure perspective, kind of moving on to that, like how do you see that playing a critical role to both blockchain as well as analytics?
Absolutely. And so this is one of the great conundrums of stakeholders in healthcare traditionally. It's how do we address the problem of needing a network of payers, providers, and all of the stakeholders involved with the ability to appropriately access data, to understand its origins, run analytics on it, and make it generally available with that security. Blockchain is a critical piece of these new type of networks that will be formed as an infrastructure layer to allow these efficiencies to actually happen. The infrastructure layer is critical to allowing a better way of smoothing data access just at scale from all of the parties involved. But you have to have that verification layer to, add the needed capabilities on top of it. This is not a free-for-all, and it's one of the interesting points of why faxes were used for so long, because they were seen as one of the best ways of doing that. Luckily, you have a lot of innovative companies that understand that's no longer really the best way, and they're embracing the future of how healthcare is going to interoperate.
Dan, thank you for your time today.